Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Vitiligo. Introduction. Vitiligo is a disorder in which white patches of skin appear on different parts of the body. It can also affect the eyes, mouth, and nose. Vitiligo happens when the cells that give skin its color are destroyed. No one knows what causes vitiligo. Using sunscreen will help protect affected skin, and cosmetics can cover up the patches. Treatments for vitiligo include medicines, light therapy, and surgery. This program explains vitiligo. It covers what it is, its symptoms, and what causes it. The program also discusses the diagnosis and treatment of the disorder. The skin and its color. The skin is the body's outer covering. It protects us against heat, sunlight, injury, and infection. It helps regulate body temperature, stores water and fat, and produces vitamin D. The skin has two main layers, the outer epidermis and the inner dermis. The deeper part of the epidermis contains melanocytes. Melanocytes are pigment cells. They produce melanin, the pigment that gives skin its natural color. Melanin also contributes to hair and eye color. When skin is exposed to the sun, melanocytes produce more pigment. This causes the skin to tan or darken. Melanin makes the skin darker to protect it from the sun. Without enough melanin, the skin cannot protect itself, resulting in sunburn. Our skin color is determined by how much melanin our melanocytes produce. People with darker skin have cells that produce a lot of melanin. People with lighter skin have cells that produce less melanin. Symptoms. Vitiligo can start at any age. However, symptoms usually appear between the ages of 10 and 30. White patches on the skin are the main sign of vitiligo. These patches are more common in areas where the skin is exposed to sun. White patches are common on the hands, feet, arms, face, and lips. Other common areas for white patches include around the mouth, eyes, genitals, navel, nostrils, rectal areas, armpits, and groin. The affected skin can lighten or turn completely white. In some cases, people with vitiligo may have itching or pain in these areas. For some people with vitiligo, the white patches do not spread. In others, the patches will spread to other parts of the body. Sometimes this happens slowly, but it can also spread quickly. Often, vitiligo appears in certain patterns, including generalized, segmental, focal. Generalized vitiligo is the most common. It can affect the entire body. Often, the skin and other areas that are affected lose color symmetrically. Segmental vitiligo only causes symptoms on one side of the body. This pattern usually causes symptom at a younger age and stops progressing after a year or two. Focal vitiligo affects less of the body. The color loss may be only in one or a few areas. For example, a person with focal vitiligo may only have white patches of skin on his or her right leg and foot. People with vitiligo may also have hair that turns gray early. Those with dark skin may notice a loss of color inside their mouths. If you have these symptoms, talk to a healthcare provider. Only a healthcare provider can tell you if your symptoms are caused by vitiligo or some other cause. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Vitiligo happens when the melanocytes that give skin its color are destroyed. Doctors do not know the cause. Vitiligo may be an autoimmune disease. These diseases happen when your immune system mistakenly attacks some part of your own body. In vitiligo, the immune system may destroy the melanocytes. It is also possible that vitiligo is a genetic disorder. This would mean that one or more genes make a person more likely to get vitiligo. Some researchers think that the melanocytes destroy themselves. Others think that a single event such as sunburn or emotional distress can cause vitiligo. However, these events have not been proven to cause vitiligo. More research is needed. Diagnosis. Your healthcare provider will make a diagnosis based on your medical history, physical exam, symptoms, and test results. Other medical problems may need to be ruled out to diagnose vitiligo. You may also be asked about your family's medical history. It is possible that having a family member with vitiligo or any other autoimmune disease increases a person's chances of getting vitiligo. A physical exam will be performed to examine the affected skin. A physical exam can help rule out other medical problems as well. Certain medical tests may be needed for a diagnosis of vitiligo. Tests might include an eye exam, blood tests. A biopsy can also help diagnose vitiligo. A biopsy is when a sample of the affected skin is taken. The sample is then examined under a microscope to look for abnormalities. Treatment. Vitiligo is not dangerous to your health. However, treatments can help make the skin look better in some cases. There are many different treatment options available. The choice of treatment depends on the number of white patches, how widespread the patches are, what the patient prefers. Some treatments are not right for everyone. Many treatments for vitiligo can have unwanted side effects. Treatments can take a long time, and in some cases they may not work. Current treatment options for vitiligo include medical, surgical, and other treatments. Most treatments aim at restoring color to the white patches of skin. Medicines can help some people with vitiligo. Medicines may be taken by mouth or may be applied to the skin as a cream. For example, steroid creams can be helpful in returning the color to white patches in early stages of the disease. Special medicine combined with ultraviolet light can be used to treat vitiligo. Sorolin photochemotherapy, or PUVA, is a medicine that reacts with ultraviolet A light to cause the skin to darken. PUVA comes in pill form and as a topical cream that can be applied to the skin. After using the medicine, white patches are exposed to sunlight or ultraviolet light from a special lamp. Other light therapies like PUVA can treat vitiligo as well. These other light therapies use ultraviolet B light instead of ultraviolet A. For people who have vitiligo on more than 50% of their body, depigmentation may be a treatment option. Depigmentation involves applying a drug to the normal areas of skin. This drug fades the rest of the skin on the body to match the areas that are already white. Surgical treatments may be an option for some people with vitiligo. For people with small patches of vitiligo, skin grafts may be taken from a normally colored part of the patient's body. The graft is then attached to the affected skin area. Small white patches can be tattooed with a special instrument to return color to the skin. However, it is difficult for a doctor to match a patient's normal skin coloring. There are also many treatments that focus on coping with vitiligo. For example, sun exposure should be limited for people with vitiligo because skin without color sunburns easily. Sunscreens that protect from both UVA and UVB light should be used to protect the skin from damage. Cosmetics can help minimize the appearance of white patches on the skin. Some examples include stains, makeup, or self-tanning lotions. Many people with vitiligo also get counseling or attend a support group. These options can provide help in coping with the emotional aspects of vitiligo. Talk to your healthcare provider about which treatment option is best for you. He or she can also tell you about the specific side effects for each kind of treatment.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Vitiligo is a disorder in which white patches of skin appear on different parts of the body. It can also affect the eyes, mouth, and nose. Vitiligo happens when the cells that give skin its color are destroyed. For some people with vitiligo, the white patches do not spread. In others, the patches will spread to other parts of the body. Sometimes this happens slowly, but it can also spread quickly. No one knows what causes vitiligo. It may be an autoimmune disease or a genetic disorder. Some researchers think that a single event such as sunburn or emotional distress can cause vitiligo. However, more research is needed. Vitiligo is not dangerous to your health. However, treatments can help make the skin look better in some cases. Treatments for vitiligo include medicines, light therapy, and surgery. Using sunscreen will help protect skin, and cosmetics can cover up the patches.
Thank you for using Explain.